General Bergman.
Good morning, Mr. Chairman.
Good morning, General.
Chairman Tucano, Ranking Member Rowe, and my fellow members of the committee, I sincerely appreciate the opportunity to testify before you all today in support of legislation introduced by myself and fellow veteran Representative Chrissy Houlihan of Pennsylvania. Our bill, H.R. 3495, the Improved Well-Being for Veterans Act, proposes a grant program for the Department of Veterans Affairs to make real strides in the fight to end veteran suicide, the crisis plaguing our nation today. We have worked diligently to grow bipartisan support for this bill in the House as well as in the Senate, where Senator Boozman and Senator Warner proposed this policy. I urge the committee to take up the legislation as a next step in our work to end veteran suicide. Over the past 15 years, the VA has received billions of dollars from Congress for mental health and suicide prevention services, and the committee has worked in a bipartisan manner to advance various related efforts. In this time span, however, the key statistic has not changed. Approximately 20 veterans are still taking their own lives each and every day. There is still much work to be done, especially considering that the VA found that 14 of the 20 veterans who die by suicide each day, that's 70% of those veterans, have had little or no contact with the VA care system. Thankfully, there are thousands of organizations throughout the nation supplementing our efforts at the federal level to provide veterans with a comprehensive list of services to assist with care, employment, and benefits. There is no single reason that leads to a veteran's decision to end their life, which is why this legislation embraces a wide range of services and solutions to reduce suicidal ideations. The Improve Act will finally allow the VA to tap into, develop, and enhance this nationwide network of boots-on-the-ground organizations providing countless life-saving services to veterans. Specifically, H.R. 3495 creates a new grant program that the VA can use to support and connect with nonprofits and community organizations, including state and local entities, that coordinate or deliver services to at-risk veterans. Under this new program, the VA would be authorized to support services that include, but are not limited to, outreach, mental health screening, suicide prevention education, case management, peer support, assistance in obtaining VA and other public benefits, medication management, therapy and training, and assistance for child care and financial planning. Additionally, before awarding any grants, the Improve Act requires that the VA to consult with various stakeholders, including VSOs, community mental health and suicide prevention partners, representatives for local and state governments, first responders, the National Guard and Reserves, and organizations with the experience required to design an information measurement tool. To not measure outcomes when you create a program, I believe, is dereliction of duty on the part of even the VA and us in Congress. This coordinated effort must determine the criteria for grant recipients and establish a framework for the VA and community partners to share information. The VA and these groups must also develop a measurement tool for grantees to use, which will allow the VA to track baseline, post-treatment, and long-term mental health data. These measurements will provide us with the information needed to study VA suicide on a large scale and make policy that addresses its very complex nature. To summarize, the Improve Act is a new strategy that enlists help from community partners close to veterans, and it responsibly tracks the effectiveness of the VA's efforts. In my role as ranking member of the Subcommittee on Oversight and Investigations, I often ask for a sense of urgency from the decision makers who testify before us. There is perhaps no more urgent matter for us as policymakers than to reach our veterans and service members who might be contemplating suicide. We have seen a rising tide of support for the Improve Act, including national VSOs and the Secretary of Affairs, Mr. Robert Wilkie, who recently identified the need for the Improve Act in order to help the VA reach more at-risk veterans. The VA can't do it alone. We need the community involved in this. On behalf of my fellow veterans across the nation struggling To deal with mental health issues, I request that the committee formally consider H.R. 3495 and work to pass this bill in a bipartisan manner. And I know that the staffs are working diligently to come up with language that we all can agree, but the end game is simple. Stop veteran suicide and hold the entities accountable for providing those services. Thank you, Mr. Chairman, and I yield back.
Thank you, General Berg. Thank you, General Bergman. Dr. Rowe, you have a comment?
Just a very brief comment. General Bergman, thank you for introducing this. It's going to be, you are correct, it's going to need to be an all hands on deck. The VA can't do it alone. I'm a perfect example of a veteran who is a Category 8 that can't go to the VA. So if I needed those services, where would I go? And we have some ideas for Guard and Reservists. We know that that rate is very high, but I think we're going to have to do, we can't keep doing exactly the same thing that we've been doing all these years. So I agree with you 100%. We've got to offer other alternatives, and certainly if the VA supports this alternative, I think we should seriously look at it. I yield back. Thank you.
Thank you, Dr. Rowe. General Berg, when we spoke yesterday, I'll be working with you and committee staff and your staff, and we'll work together to make sure that the VA has the resources and expertise to administer grants properly, and that we also want to make sure that Congress has oversight over the program to hold the VA accountable, and we just can't give them a blank check. We want to make sure that we have accountability in place, and we'll work with you on this.
You know, thank you, Mr. Chairman, and you know, there is, as a Marine and as a veteran, we never ask for a blank check. All we ask is for the tools necessary to win the fight, and I, under your leadership, and we are as good as we are as leaders because our staffs do all the hard work, and thank you for your support and the staff's diligent efforts working together on this.
Yes. Thank you, General Bergman. And I appreciate the bipartisan way in which we're trying to tackle this really stubborn problem, this stubborn challenge. And I appreciate the spirit in which we're doing this together.